I have concern for any infectious disease that is spreading in a community. You know, the nice thing about this disease is that it is completely preventable. Its disease process and manifestations and the complications are completely preventable with the vaccine. Now, I think there should be concern if you or your loved ones are not vaccinated. We know that in the current outbreak and historically, this continues to be a disease of the unvaccinated. So if you and your family are vaccinated, you are safe. There is nothing to worry about, even if there is an exposure notice of maybe somewhere that you have been. If you and your family are not vaccinated, then I would certainly be concerned. I would be concerned because it is not a benign disease. Measles can cause significant morbidity and mortality. Measles, people who get measles, 1 in 5 can go to the hospital. 1 in 20 can get pneumonia, either from measles or a bacterial pneumonia. And we obviously know that 1 to 3 in 1,000 cases have the possibility of dying as well. Not to mention further complications that are also present with this disease. So I think, again, if you are vaccinated and your loved ones are vaccinated, you don't have anything to worry about. If you are unvaccinated, I think there should be concern, and I would talk to your physician, your pediatrician, understand your vaccine status, and get vaccinated if you can. I think that's very important. So in the United States, vaccination for MMR, measles, mumps, rubella vaccine, starts at 12 months. In certain times, such as outbreak situations, a baby can get vaccinated as young as 6 months. This will help provide protection. We know that when mothers are vaccinated, they then transfer their antibodies and their immunity to the baby for the first 6 months of life. So I think that is important to know. And if you are in a county or an area where there is a local spread of the disease, and for instance, your baby or your child is not vaccinated and they are 6 months or older, I would certainly advise getting that vaccine. We have decades and decades of high quality, good data supporting the safety of the vaccine and also the efficacy of the vaccine. We know that infectious diseases never adhere to borders or demographics. They infect who they can infect. And right now, the people that are most at risk of infection are those with no immunity, particularly those that are unvaccinated. Throughout recent times, we know that the vaccination rates in Kansas have decreased under the typical herd immunity vaccine level of 95%. So with that, we know that there can be higher risk of local spread. And so when you vaccinate yourself and your loved ones, you're not only protecting your family and your immediate people that you know, but you're also helping to provide protection in the community as a whole to help stop spread in that community as well, to get back to that 95% vaccine coverage so that we can have herd immunity.